Hello, my name is Angela Baker, and I'm bringing to you a presentation by experts on suicide. A brief overview of suicide. Suicide is the intentional act of ending one's own life, and it usually is the result of a psychiatric or mental disorder. The topic is interesting because the Centers for Disease Control and Prevention, CDC, reports 41,149 individuals committed suicide and approximately 494,169 received medical treatment for self-inflicted injuries. Evaluating suicide is important because the World Health Organization, WHO, reported an estimated 800,000 suicides worldwide in the year of 2016, and suicide is the second leading cause of death among 15 to 29-year-olds worldwide. It is very common to discover that suicidal individuals are trying to avoid emotional and physical pain, and that they believe they cannot deal with this pain anymore. Sometimes they are very angry. They display their anger by lashing out towards others, and the end result is that they take their own lives. I have two questions regarding suicide. What are the most common psychological and mental disorders in those who commit suicide? And what are the warning signs in an individual contemplating suicide? Now I'd like to introduce you to our experts. Expert number one is Dr. Ronald William Maris, and he is a forensic suicidologist and a professor at the University of South Carolina. Dr. Maris has authored or edited 21 books. Dr. Maris was originally trained as a behavioral scientist. His PhD in social psychology, sociology, was from the University of Illinois, and it was an epidemiological investigation funded by the NSF of 2,153 Chicago suicides and controls. His dissertation was published by the Dorsey Press in the year of 1969 as well. Dr. Maris practiced medicine at Johns Hopkins. He performed psychotherapy with the in- and outpatients, and he was funded a basic suicide research. He was a treatment team member for inpatient care and performed treatment and research in the Hopkins Psychiatry ER as well as in Sinai Hospital. Our second expert is Dr. Mace Beckson. Dr. Beckson is a forensic psychiatrist. Dr. Beckson is also a UCLA's Health Sciences Clinical Professor of Psychiatry and Biobehavioral Sciences. He is also an addiction psychiatrist at the VA Greater Los Angeles Healthcare System. Dr. Beckson obtained his A.B. magna cum laude in biochemical sciences from Harvard College and his medical degree from Cornell University Medical College before completing his training in psychiatry and behavioral neurology at the UCLA Neuropsychiatric Institute. Dr. Beckson directed the Psychiatric Intensive Care Unit of the VA Greater Los Angeles Healthcare System as well. His focus was on risk assessment and risk management of suicidal and violent patients with substance-induced and primary psychotic disorders. These patients also had mood disorders, addiction, and dual diagnoses with addiction pain issues, PTSD, and hospital safety. Let's take a look at the opinions of expert number one, Dr. Ronald William Maris. Dr. Maris provides enormous insight into the medicalization of suicide and the issue that millions of Americans are taking antidepressants since the 1950s. He argues these actions are partly driven by carefully guarded economic interest where billions of profits are being made. He shares the view that these actions are not entirely a cure for suicide because suicide rates have actually increased. Suicide is an important public health issue involving psychological, biological, and societal factors. After a period of nearly consistent decline in suicide rates in the United States from 1986 through the year of 1999, suicide rates have increased almost steadily from the year of 1999 through 2014. While suicide among adolescents and young adults is increasing and among the leading causes of death for those demographic groups, suicide among middle-aged adults is also rising. A link to a website that Dr. Ronald William Maris recommends is to the American Association of Suicidology. The link is at suicidology.org. Now let's take a look at expert number 2, Dr. Mace Beckson. Dr. Beckson shares the opinion that certain psychoactive substances may have profound effects on mood states. They can also have an effect on a person's cognition, behavior, and physiology. Drugs and substances can influence how we function in our interpersonal and social context. Substance abuse can also lead to death or suicide. The opportunity for drug overdose exists when clinicians provide large amounts of medications for at-risk patients who are seen briefly and infrequently. A review of 16 ecological studies concluded that there was an inverse relationship between suicide rates and the use of antidepressants across all age groups. A particular website that Dr. Mace Beckson recommends that is very interesting goes to the Society for Risk Analysis, that is the SRA.org. Now let's compare and contrast the views of each of these experts. Dr. Maris seems to share certain points that are circulated around preventable, societal factors, and economic factors. Dr. Beckson's points are related to substance abuse, psychoactive drugs, and addiction. But it is great that both of these experts seem to come together on one particular point that they both seem to agree upon, and that is that suicide rates have increased steadily in the United States, and psychoactive substances can play a significant role in suicide. I'd like to take this time to thank you for viewing this presentation related to experts on suicide.